The venue of the screening and sensitization program by the Anambra State Health Insurance Scheme, ASHA for state workers, Anambra State, is at the Teacher's House, Awka. Civil servants gathered to be part of an exercise that gives them a sense of belonging and inclusion ahead of the 2024 May Day celebration. The program, organized in collaboration with the Nigeria Labour Congress, is aimed at preventing both primary and secondary health challenges, as well as scale-up efforts towards achieving universal health coverage in Anambra State.
As we are serving our state, we face a whole lot of challenges. Everybody knows that. And one of the major challenges that we face as workers in the state is the issue of health. Health. We often hear that health is wealth. If you're not healthy, you can't even serve the state properly.
The managing director of the Anambra State Insurance Scheme, Dr. Simeon Onyemechi, reminds the workers of what the insurance scheme is all about.
You usually got these requests to contribute some money to pay all health hospital bill for a colleague of ours at work has drastically reduced, if not completely eliminated, because the state government now has this health financing mechanism to take care of us when we are sick.
He also educates them on the need for constant checkups. And on trying to find out how often the workers engage in medical checks, he gets a not so encouraging response. The screening exercise then commences.
Okay, have you checked in the last 3 months? In the last 3 months?
The exercise is a step in the right direction as healthcare is now made accessible to everyone in the state.
And everybody has to keep making efforts to check their different statuses. Now, people have started taking this seriously. More importantly, because of the fact that we now have an insurance scheme whereby people don't have to pay those astronomical hospital fees in order to have their health taken care of.
When you give attention to the health of workers, their productivity, the output will be very high. And that's why I said, they say that all works and no play makes Jack a dull boy. But in this time, that we are going to engage our workers with the government already established a health agency called ASHA.
It's in line with Governor Chukwuma Soludo's blueprint on health, as the healthcare needs of over 1,000 workers are being taken care of in the exercise.
With the turnout, we have seen about 1,400 civil servants having this done today at the cost that we have put in. We are very excited that we will prevent a lot of diseases and detect a lot more earlier in such a way that ultimately the agency will spend less because of issues around primary and secondary prevention that will go in ultimately to save us costs and then ensure that we can, on a sustainable basis, cater for the healthcare needs of our people.
The Anambra State Health Insurance Scheme was launched on 14 September 2018 after the law establishing its enactment was passed in 2016. The mandate is to provide quality and affordable health care to Anambra citizens, and the agency is living up to its bidding.
For more on the health insurance scheme in Anambra, Dr. Simeon Onyemechi, Managing Director of the State Insurance Scheme, joins us now from Awka, the state capital. Hello and welcome to the program. Thank you for joining us.
Thank you so much. Good afternoon.
Yeah, quite a turnout there, but in practical terms, how does the State Health Insurance Agency ensure that civil servants receive comprehensive healthcare coverage that meets their needs, considering factors such as age, pre-existing conditions, and specialized medical requirements?
Yeah, thank you so much. Just to say that ours is a scheme that mirrors clearly from the point of conception all of the contextual diseases that we have here. The health burden locally here in Anambra was clearly taken care of in developing a benefit package. The comprehensive service delivery package which we have ranges across all age groups for pediatric needs, maternal child health care needs, even up to the point of geriatric disease needs. We have ensured that looking at our disease burden as a state, that what we have included in our benefit package covers at least 80% the needs for the reasons for why our people go to hospital on a daily basis. What this has done for us is that across the spectrum, whether surgical needs, obstetric gynecological needs, internal medicine needs, pediatric needs, and what have you, Anambra State Health Insurance have an actuarially determined benefit package that has attempted clearly in the last 6 years since we have started operations to cater for the needs of our population, whether it's eye care needs and what have you. So the range of services, whether it's health promotion, health prevention, curative care, and some bits of rehabilitative care. The only exception at this point, which we haven't gone into, is issues around cancer and its management. But then the screening and detection of issues around cancer, we have also included in our benefit package. But then what we have applied is to say, at the beginning, when we designed this benefit package, with a strong political will of the state government, we put into it the principle of universal, progressive universalism, where we started small in our benefit package, and over time, as the scheme got stabilized in the last 6 years, we have gone ahead to include services that range to high-end investigations like magnetic resonance imaging, computed tomography, that's CT scan, and what have you. We have included things like prostatectomy for elderly men who will need them, for women who might need hysterectomy, that is to remove their womb completely, for things like dysfunctional uterine bleeding and some other conditions for which, to save the life of a woman, you must get the womb out. Even simple things like fibroids. I don't want to get into issues about around cesarean section and what have you. No woman has any business, any reason to die from childbirth in Anambra State. So the state government has, in such a manner, funded the scheme sufficiently to ensure that there is subsidy given by the to offset the healthcare bills from the little contribution which both civil servants have to make from their salaries that are deducted and then remitted to the agency on monthly basis, as well as for those who are in the informal sector. So suffice it to say that at this point, for the over 200,000 beneficiaries of our scheme in Anambra, active beneficiaries, our benefit package has sufficiently taken care of their needs, because we know clearly from epidemiological trends what the disease burden is in our state here. So the basic things have been taken care of, and then over time, like I had said, with the principle of progressive universalism, we have tried to expand our benefit package to cover a lot more reasons why our people go to hospitals, so that when you earn monies, you do not have to put it into leaky holes that healthcare needs will consume. But rather, you earn these monies and then you rather take care of yourself, because the state has given you financial risk protection. And those who do not have these needs, those who are already poor, the benefit package is such that we are able to prevent people from falling further into poverty.
And that's quite expansive. Quite expansive there. You said 200,000 beneficiaries. I'm wondering if that's the size of the workforce of the Anambra State government, when you consider the state secretariat, the ministries, departments and agencies, and the local government officials as well. I wonder if that's the size of the workforce, and what provisions are on ground to make this regular screening regular and accessible to all workers of these categories that I've outlined.
Yeah, thank you so much. Actually, what we have here, we have a formal sector program for the civil servants. We have informal sector program for those who are not employed by government. Anambra State Health Insurance Scheme Law 2016 makes health insurance mandatory for every resident of Anambra State. But to the extent to which this mandatoriness has been enforced, for the fact that you will think of the chicken and the egg, which one comes first, enforcement government is being very pragmatic and sensitive to the realities of the day economically in enforcement. But of these about 230,000 enrollees, the civil servants population accounts for just half of that. A lot of private individuals, truck pushers, akara sellers, the farmers in villages, because here in Anambra, there's what we call adoption model, which is indigenous to us. And every other state across Nigeria today have come to copy that from what we do here, where we pitch to people, philanthropists, to say, exploring the social and socio-cultural ties that we have here to get our people who are philanthropic in nature to pay health insurance premium for others. So in Anambra, we have that over 60,000 persons from the informal sector, people who ordinarily may not be able to pay health insurance bills. People now do Christmas charities with payment of insurance premium. At 12,000 naira, if you reside in Anambra, you will get cover for a full year. And all you now need to do is when you get to the healthcare provider of your choice, over 250 of such accredited healthcare providers in Anambra, you get these services and pay just 10%. So the civil service population, by about 50% of our clients at this point. Now, what we have done is to say, among civil servants,
indeed,
go to facility.
There's a lot of prospects there from your explanation, but we're totally out of time. I must apologize. We're totally out of time. We look forward to having you on another edition of the program so that you can expand further on the coverage of the Anambra State Health Insurance Scheme. Dr. Simeon Onyemechi, thank you so much for your time on the program.
Thank you. I appreciate it.